8 ways of treatment. So there are the 8 ways of treatment to address the low back pain and sciatica. First, as I said before, do nothing. It will settle in a couple of days or maybe in weeks, but you don't need any treatment at all. I'll come in the later on to elaborate this. Second is medicine. Third is physical therapy. Fourth is spinal injection. Fifth is minimally invasive spinal surgery. Sixth is microdiscectomy. Seventh is laminectomy and discectomy. And eighth is spinal fusion. If you see patient around you, mostly patient, they come under this seventh treatment, laminectomy and discectomy. Because as I said earlier in the presentation, that if you have a hammer in the hand, you do nothing. Just need assurance to the patient that it will get better on its own and continue to normal activities. No need of rest, because rest is death and moment is life. If you do the rest, your muscle will get more weak and more wasted. So rest is not recommended for the back pain. If you can't move, that is not rest, that is disability. Then we go on the second and third treatment. But doing the rest just in a sake that I'll do the rest and my back pain will get better, it is not true. If you move, it will get better. Pain hurts, but it's not harmful. For the muscle, it says use it or lose it. If you use the muscle, it will develop. If you don't use it, it will get wasted. Second is medication. And medication also, do not start from the day one. If you, in a couple of days, 2-3 days, if you feel the pain is not settling down, or if pain is more, you can take straight away the painkiller. But if you feel the pain is not much and you can move around, to try the first method. And if you feel that the pain is not getting better, or 2-3 days gone and pain is still there, then you can take the medication like paracetamol, muscle relaxant, non-steroidal anti-inflammatory drugs, and lacosamide or gabapentin. These doctors can recommend you. This is when the pain is not only in the back, but when going down the legs, then we can add this also. Physical therapy. Physical therapy, there are so many modalities in the physical therapy, but main thing is the manual manipulation of the joints and addressing the trigger points. Mostly the patient prefer these machines, that shortwave diathermy and ultrasonic and mega infrared and all these things. But basically the treatment which gives benefit to the patient is to release the trigger points. Injection therapy. People think that injection is dangerous, but no, it's not. It is, you can give the injection in the facet joint, steroids, or with local anesthesia. And nerve root injection, there are 4 types of injection you can use. This facet joint injection, if you see on the X-ray or CT scan or MRI that there is a degeneration in the facet joint, you can give that. For the nerve root injection, if not responding to the conservative treatment.
समझ नहीं आ रही
क्या समझ नहीं आ रही?
From where you are not from where you are missing, can you?
Nerve root injection.
I think it's the volume.
उर्दू बोली समझ नहीं आ रही, उर्दू बोले.
अच्छा, उर्दू बोले.
Are you not hearing properly?
Okay. No. He say that it's not in Urdu. That's what he's saying. That what he's saying, that is the presentation is not in Urdu, so that's why he is not able to understand. So
क्या मैम कह रहे हैं, उर्दू बोले.
अच्छा. So these 4 injections, that facet joint injection, nerve root injection, epidural injection, and intradiscal injection. Now in intradiscal injection, now they also putting the ozone also. Ozone and stem cell therapy. I'll come later on this, but this is the 4th way of the treatment. Then acupuncture also, I have put in the injection as it's needles and still used in the Islamabad and other countries. Minimally invasive spinal surgery. This is This is me here. This was long ago in Innsbruck doing the minimal invasive spinal surgery, and the advantages of the minimal invasive spinal surgery is that it is the patient is awake
Please English,
and
no Urdu.
awake and awake and Mulazim, can you please stop his speaker, please, microphone, please. Awake and aware state surgery with the precise targeting of the pain generators. So patient is awake. The difference between the minimal invasive spinal surgery and the conventional surgery is that the patient is awake and you can communicate with the patient that, and when the patient touches, the surgeon touches the nerve and the pain results, we can ask the patient that is it the same pain which you feeling. He say yes or no. Then we touch another disc, another disc. So to find out the exact location of the pain generation, then we address that. Similarly, in the here in many hospitals, they do under general anesthesia, which is wrong. It should be under awake and aware state that you can communicate with the patient to locate where the pain is coming from, and it is reduced surgical even we don't stitch the wound, it's because it's just like a needle and a small cannula. Increased effectiveness at the target and increased interaction during the surgery with the patient and reduced cost and mobility. This is the method that you can go with the needle and then you can put the trocar, the cannula, and so you can see easily that it is very, very minimally invasive and it is there even no stitch is needed.
Hello, assalamu alaikum.
Sixth method is micro discectomy. With the help of microscope and under general anesthesia, they do the discectomy. And seventh, decompression and laminectomy and discectomy. As I said before, that this should be tried when all other methods fails. Conservative and minimal invasive fails, then you can go for this method. Decompression and fixation is the last way of treatment, where you can fix the spine with the intervertebral disc also, or cage, or these are different methods you can fix the spine. But this is the last method. These are the references that I have collected from to prepare this disc.
Thank you so much.